Hello, my name is Dr. Edward Fruitman. I'm a board-certified psychiatrist and I'm a medical director of Trifecta Health. At Trifecta, we specialize in treatment of adult attention deficit disorder. I have a team of multiple experts and we've been collaborating for many years. Attention deficit disorder in adults is something I've been treating for 35 years. Adult attention deficit disorder in women has become a very important part of my practice lately. Ever since the pandemic, we have disproportionate number of adult women in their 20s, 30s, and 40s, who were seeing a psychiatrist for the very first time with symptoms of attention deficit disorder. Adult attention deficit disorder is not something that is based on a situational problem or a little bit of anxiety or depression that was induced by pandemic. Obviously, this was a lifelong pattern of problems for which those women were able to compensate for, but somehow did not recognize it as a problem, and they only came to attention and treatment at the time of the pandemic. I think one of the reasons for that is, in general, attention deficit disorder is underrecognized and underdiagnosed in girls, and we'll get into the reasons why that may be. And I think pandemic brought in very special stress for professional mothers, because the stress of still having to run a household as well as a professional job has become overwhelming. Women have more than partially won the battle for professional recognition and competence. However, there is still a bit of an inequality to where a lot of childcare responsibilities and household duties still fall on women. So for the very first time, women, like I said, in their 20s, 30s, and 40s came into our office asking for help with on diagnosis of attention deficit disorder symptoms. Obviously, it didn't just come out of the blue. This has been a pattern all of their life, since they were young, since they were little, and somehow those symptoms were under-recognized. Primary reason why they were under-recognized in those women, was well-diagnosed ADD, is because the way we think of attention deficit disorder and the way it's listed in DSM, the Psychiatrist Bible, is basically a copy of what a young boy would experience. Women don't experience as many of hyperactivity symptoms as boys do, and they also don't cause as many problems when they do suffer from those symptoms. Girls are more likely to be inattentive and less likely to be disruptive. Little boys who are hyperactive and hypermotor and are disruptive to classroom, of course, are the ones who get the recognition of those symptoms pretty early on. The reason why some of my patients did not get recognized as suffering from ADD when they were young is that girls tend to be more diligent. Some of the very, very successful women in New York City, they remember a pattern of unequal performance on many different tests and subjects. So let's say, 90th percentile in English and literature and history, because that was their level of interest, and being in the 20th percentile for math and physics. Both teachers and parents saw it as being lazy, like if only she'd tried harder, if only she did more, then, was the story. That actually results frequently in what I see in my patients, some really negative self-perception that comes with attention deficit disorder in girls who was under-recognized. It was seen as kind of a poor character more than a neurologic deficit that can easily be fixed by medications. Another probably reason why it was under-recognized in young girls and young women later is, I think, women are very good at masking the symptoms better than men. So sometimes it requires certain social finance. Sometimes it requires even misrepresentation, like saying, yes, everything is done, when it's really very partially done or not done at all. But of course, that creates enormous anxiety and lasting negative self-perception that actually deserves to be fixed. Looking at exactly what is attention deficit disorder symptoms and how to diagnose it, we do have a questionnaire, diagnostic tests on our website, and there are many questionnaires available. But if you think you do suffer from attention deficit disorder, it really should be diagnosed by a professional, hopefully a person who specifically is aware of how to diagnose it, perhaps a board-certified psychiatrist or a member of a team led by board-certified psychiatrist. Frequently, the symptoms of attention deficit disorder in women are misdiagnosed as either a character defect, like I said, laziness and failure to try, or is seen as anxiety or depression. It is true that women with ADD symptoms can get very much overwhelmed, and that presents as either anxiety and panic. Another frequent presentation that is important to note is emotional dysregulation. Emotional dysregulation, all of a sudden feeling very, very intense emotions about something that could be a trivial matter, is one of the symptoms of ADD in women, actually more so than in men, but also it responds quite well to medications and sometimes psychotherapy. One of the reasons why it's important to recognize the symptoms and attempt to treat them is that is a road to actually correcting those symptoms, because those symptoms respond quite well to medications, stimulants especially, and also sometimes it's a very good start for receiving appropriate kind of psychotherapy, perhaps a cognitive behavioral therapy to help address some of the negative self-perceptions that are faulty and erroneous, those self-perceptions that were only based on certain failures in the past and certain behavior patterns that can easily be corrected. And also responds quite well to the coaching approach to psychotherapy, where the focus is on increasing and improving both the structure of the day, the structure of workflow, and important reminders and other organizational tasks. It is very, very important with a treatment team that is aware specifically of how adult attention deficit disorder presents in women. Women tend to respond slightly different to medications than men. Statistically, we know that women more often respond to non-stimulant medications than men, even though stimulant medications are still considered first line in both men and women. It is also important to address some of the specific negative self-perceptions in certain behavior difficulties that are very, very specific to women. I think little girls and young women come under very special pressure to be organized, diligent, timely, and every time there is a failure of that, purely based on attention deficit disorder symptoms, some negative self-perception that becomes stable develops and really needs to be addressed and corrected. Symptoms of emotional dysregulation, sometimes feeling very, very intense emotions that are recognized as excessive for the situation. There are techniques, of course, for coping with that if medications don't relieve that symptom. And also, it's important to recognize that frequently women are really tasked with more than just professional tasks or home tasks. There's an expectation of perfection that women cannot as easily dismiss as their male counterparts, and as a result may develop certain coping strategies that are maladaptive, like misrepresenting how done they are with particular task, sometimes developing a social mode of interaction that is overly eager to please and or too fearful of punishment, or avoiding authority figures or like anger of their bosses. All of that comes from under-recognized symptoms, and once the diagnosis is made, all of that behavior can be easily addressed. If you have a question of whether or not you have adult attention deficit disorder, do try to seek professional evaluation and diagnosis, but make sure it is a qualified professional who has specific experience with not only diagnosing attention deficit disorder, but also diagnosing adult attention deficit disorder in women, because women typically in this country, in America, are better at masking those symptoms than men, and also don't come to attention as frequently as in other places. The prevalence of adult attention deficit disorder in women is probably as high as 5%, 1 out of 20. Men do have it more frequently, but like I said, are also more frequently recognized for those symptoms. There are specific support groups for women with adult attention deficit disorder, and there are important publications and societies that may be helpful. Like, for example, there is a magazine called Attitude that has a lot of helpful information, and it is in public domain. Like I said, medications and therapy can be very, very important. Sometimes lifestyle changes are also due, because adult attention deficit disorder symptoms can also result in inappropriate sleep habits, disordered schedule of the day, and also a disorder that also needs to be addressed. In summary, adult attention deficit disorder is very frequently underrecognized in women. The treatment and therapy has to be highly specific to women with ADD, and that the treatment can make an enormous difference. So it's important to get it recognized and get treated in time. Thank you for watching and listening. This is Dr. Edward Fruitman. Please subscribe to my channel, and if you have questions, please write to us, because I would like to make it a part of our follow-up videos.